Welcome to the show, where we share the stories of the many who intersect with our healthcare system but are rarely heard from. My name is Kevin Poe, founder and editor of Kevin.md. Rate and review the show at kevinmd.com/rate. Subscribe at kevinmd.com/follow. Today in the show, we have Christina Chen. She's a family physician. She wrote a KevinMD article debunking the myths around asynchronous care. Christina, welcome to the show.
Thanks for having me, Kevin.
We'll get into your article in a little bit, but first off, can you share your story and journey to where you are today?
Yeah, so I'd say early on in my career, I worked in a variety of clinical settings, including community health clinics, fee-for-service organizations, as well as your typical HMO, ACO organizations. And even though the settings were different, the challenges were often the same. So process inefficiencies that ultimately fell on me as a physician to make up for, being bogged down by documentation and administrative burdens and really not being able to just practice medicine. It was really discouraging, frustrating, and honestly, I was really unhappy. So in 2015, I left the traditional brick and mortar clinic setting, hoping to find a way to use my medical education and training in a non-traditional way. Mm-hmm. At the time, I had no idea what that would look like or even where to begin my search. And by chance, I landed two separate independent contract roles in the emerging field of telehealth. So my first one was as a provider for Amwell's online care group, where I saw patients via video for a variety of health systems and payers across the country. I think at one point I had 9 or 10 different state medical licensures. And my second independent contract role was for writing clinical content for Bright.md's Asynchronous care platform. And it was really interesting to be in both of these roles in the really early days of telehealth. Mm-hmm. Back then, there was a lot of skepticism, right, around treating patients without being able to lay hands on them or do a physical exam, and even more so about treating patients asynchronously without even any sort of direct interaction. I admit I had my doubts as well, but with time and experience, that skepticism started to fade. And I found that there was a lot of overlap between the types of conditions I was treating patients for via video and the conditions that I was writing clinical content for. Mostly those low acuity common conditions that could easily be treated symptomatically with over-the-counter medications, women's health concerns, UTIs, yeast infections, birth control, or patients who simply needed reassurance that, yes, this will get better on its own, and no, this isn't something that you actually need to go in and be seen for. So in the middle of 2018, I officially joined Bright.md as a physician editor, really focusing my time and energy on helping to develop, grow, and improve on the asynchronous care platform. And since then, my role has slowly expanded to what it is today as medical director. So a large chunk of my time is still spent working with our content team to create and maintain all of the clinical content that is in our platform. But I also work a fair amount now with our sales and marketing teams, our customer success teams, as well as our product teams.
So what are some of the challenges that you face moving from a clinical role into the role you're currently at now?
I think a lot of it was really personal, thinking about, I went to medical school for all this time and I did residency and all this training, and now I'm not seeing patients anymore. So it was really a personal sort of internal battle of, am I still a doctor? Like, did I do all of this for nothing? Or is it enough that I'm in this different realm now, still treating patients indirectly and really trying to improve healthcare as a whole.
Sure. All right, let's talk more about asynchronous care in your KevinMD article. It's titled Debunking the Myths Around Asynchronous Care. Now, for those who didn't get a chance to read that article, can you just walk my audience through it and share the story of why you decided to write it?
Yeah, I think I would start with saying, what is asynchronous care? Yeah. A lot of people don't know what it is, and that's understandable. It's really a new modality of care. And so for asynchronous care, allows providers to treat patients virtually without a real-time face-to-face interaction. And for us at Bright.md, that currently applies to common low acuity conditions. And we do this by automating both the patient interview and the clinician documentation. We also provide clinical decision support, so while maintaining provider autonomy, so keeping the clinician in control of the diagnosis and treatment plan at all times. So again, there's a lot of confusion and misconception around asynchronous care, being that it is a relatively new modality of care. But I also have the unique role of partnering closely with clinician executives and providers as they experience the power of asynchronous telehealth. So not only are they using it to deliver high quality care, but now they're also advocating for its value as a telehealth tool. And I really believe that unlike other digital tools out there, asynchronous care really has the potential to transform healthcare for all parties, the patient, the provider, and the health system. So the article I wrote really goes into, what is asynchronous care, what it isn't, and then addressing some of those common myths.
So tell us some of these common myths about asynchronous care and tell us the truth that punctures those myths.
Yeah, gladly. So I would say one of the main ones we hear is that asynchronous visits are not as effective as a face-to-face interaction, whether that be via video or in person, because there isn't that real-time interaction or that physical contact with the patient. But I think the truth is they can certainly provide the same quality of care for certain conditions, right? So through thorough, consistent digital clinical interviews that are evidence-based and dynamically changing based on the patient's responses, we mimic the history-taking process that normally takes place in any synchronous interaction. In fact, a lot of clinicians tell me that the asynchronous interview is more comprehensive and more thorough than they often have the time or capacity to do when speaking directly with the patient. And once that digital interview is complete, the patient's responses are used to generate a progress note for the provider to review. And we also show them a list of relevant treatable diagnoses and their associated evidence-based treatment options. So this allows for delivery of care that meets and often exceeds national quality standards, and it's done in a fraction of the time. So our data shows that providers can deliver care for these low acuity common conditions in less than 5 minutes, and that includes completing all of their clinical documentation. And for the patient, they're waiting less than 10 minutes between the time they submit their interview to the time that they receive a diagnosis and treatment plan. So that's pretty remarkable. Another common myth that we hear is that asynchronous care means chatbots and symptom checkers. And I think it's really crucial to make a distinction here. First and foremost, asynchronous telehealth can provide end-to-end definitive care, while most chatbots or symptom checkers can only give the patient, a list of possible diagnoses. Here are the 5 things that your symptoms could represent, or they just direct the patient to another venue of care to get that definitive care. I think also, chatbots and symptom checkers are designed specifically to remove the clinician from the patient interaction. And that's the opposite of what asynchronous care does. There's no direct real-time interaction, but there's always a provider at the other end providing care for the patient. Although we offer clinical decision support, we're not trying to replace the provider. The provider is always in control, has autonomy over how they diagnose and treat a patient, including the ability to escalate that patient to a higher level of care when needed.
So give us a case study or an example of how your solution would work in a typical primary care setting.
Yeah, I think probably one of the ways that would be most helpful would be, all of us primary care docs get inundated with our inbox, right? Yeah. Email messages that you're trying to answer in between seeing patients, answering phone calls, answering questions from your nurse. So let's say you get an email message from a patient who says, hey, I think I have a UTI again. I haven't had one for a year. Can you just prescribe me the antibiotics that I got a year ago? And rather than having a back and forth email chain, right? Okay, can you tell me about your symptoms? Send it to the patient. They maybe respond in an hour or two. And then you see that follow-up email, oh, they forgot to answer one of the questions. I need to follow up with them and answer. So it goes back and forth, back and forth. They could last, several hours, even several days, depending on how busy you are and how busy the patient is. On the flip side, if a patient emails you and says, hey, I have a UTI again, same email, and you say, hey, why don't I send you a link and have you fill out this clinical interview? It'll ask you all of the questions that I need the information for in order to treat you. And that's a one-time sort of interaction, right? And then you, or depending on how you staff your asynchronous solution, a provider can simply review the chart note that's been generated by that interview and provide treatment for that patient right away. So we're taking a maybe hour-long to day-long process and cutting that down to less than an hour.
So a typical interaction, would you say, how long would that last?
Yeah, so it typically takes a patient anywhere from 10 to 12 minutes to complete the interview. And then again, depending on how this is staffed, we have a lot of health systems who have a virtual care hub, which is a group of physicians who are answering all of these asynchronous care interviews, right? So it may not be, if I fill out an interview, it may not go directly to my primary care doctor, but it will go to a physician within my health system or within my care group. So again, 10 to 12 minutes for the patient to fill out the interview. And then from the time of submission to the time that they get a treatment plan is usually about 6.5 minutes, and providers take up about 3.5 minutes of that time. So it's really a lot faster and more efficient for both the patient and the provider. And again, you know, the patient is not having to get on video or have a broadband connection or drive into the clinic. And the provider, again, is having all of that information presented to them in a succinct way, where they can just, you know, agree, disagree with the diagnosis, change the diagnosis, sign the chart note, and then that's it.
Now, you mentioned that this is available for a limited number of conditions. What are some of the more common conditions that asynchronous care can be ideal for?
Yeah, so I would say the ones that are kind of top on our list are cough, cold, flu, and COVID, obviously, within the last 2 years. Rash is very common, pink eye, ear pain, and surprisingly, behavioral health is actually one of our fastest growing interviews. Now, that's not necessarily a low acuity common condition, but we have found that it's really a need out there. Obviously, there's a mental health crisis in our country, lack of providers, and then the costs associated with mental health care. And then a lot of patients still feel a stigma when seeking care for mental health conditions. So this is sort of an easy, accessible way where patients can start their mental health journey. So they fill out a clinical interview, most of which for our behavioral health is made up of validated screening tools, right? Which are easily amenable to a digital format. So the PHQ-9, the GAD-7, we screen for psychosis, mania, substance abuse. And so that is really amenable, like I said, to a digital interview. And then we present that to the provider, and they have a variety of options, right? They can start the patient on anti-anxiety meds, they can start the patient on antidepressants, or they can refer to a behavioral health specialist within their system. We also have been doing referrals to digital therapeutics like the Calm app or the My Strength app. So really just getting that patient started on their mental health journey and getting them plugged into the health system.
A lot of times during a telehealth visit or a virtual visit, we can get a lot of clinical information from that virtual face-to-face interaction. I can see what the patient looks like. They can show me stuff. I can even see the background of what their home is like, and that gives a lot of clinical information. So if we needed that additional piece of information, what would be the next steps through their asynchronous platform?
Yeah, so providers always have the opportunity to escalate patients to a higher level of care. So if I'm a provider doing asynchronous care and I'm reviewing the chart note and I feel like, I just want to, talk to the patient on the phone or do a quick video visit to ask some clarifying questions, they can always escalate that patient to higher levels of care. And then depending on the health system, you can configure that to work however you want to. Like, do you send them then a direct link to an on-demand video visit where they would just go in the virtual waiting room and wait to be seen? And then you still have all of that clinical documentation that you have already gotten from their clinical interview. So it's really easy to escalate patients for those conditions or those situations where you really need even just a short face-to-face interaction.
We're talking to Christina Chen. She's a family physician, and she wrote the Kevin MD article, Debunking the Myths Around Asynchronous Care. Christina, what do you see as the future in the next year or so in terms of the Asynchronous platform and its adoption among primary care clinics?
Yeah, it's really interesting. There's really been a growth of interest in asynchronous care, spurred on again by the
Hmm.
pandemic. There are some silver linings, I suppose, to the pandemic. And so the types of conversations that we're having with prospects and health systems are really different now than they were even 6 months ago, right? 6 months ago is a lot of questions about the validity of this
Hmm.
type of care. And now it's more, this is interesting. How can I make this work for me? And I think the tides are finally turning for asynchronous care, and that's really exciting. For us at Bright.md, we're really looking to expand the scope of asynchronous care beyond those low acuity common conditions. So, how do we use components of asynchronous care to improve other areas of healthcare? Could we apply the digital interview, to conditions like diabetes,
Hmm.
asthma, CHF, right? Or can we have these digital interviews sit in front of a synchronous face to face interaction? So, it's sort of like a pre visit interview, more comprehensive than that clipboard and paper
Sure.
you get when you check into your doctor, right? So, what if a patient in a virtual or traditional waiting room is asked to complete a dynamic digital interview? And then that information is used to start an automated chart note for the provider before they even connect with the patient. How much time would that save a
Sure.
provider? And how would that change the patient provider interaction from one of data gathering and documentation
Hmm.
and typing on a computer to one of true connection, right? Because you have that history already taken for you. So these are all areas that we're really curious and passionate about and exploring for the future.
And my final question, what are some of your take home messages that you want to leave with the Kevin MD audience?
Yeah, I would say to truly harness the power of telehealth to change healthcare for the better, you need to think outside of the video visit box when
Hmm.
it comes to your telehealth tools and solutions. Providers will often tell me that a video visit changes only the geography of a visit, right? It doesn't change the time it takes to do
Hmm.
the visit, the patient interaction time, or the time required to chart versus a traditional face to face visit. Patients often encounter the same frustrations during a video visit as they do for an in person encounter. That includes scheduling and
Hmm.
long wait times in that virtual waiting room. So, for certain conditions, I think this is where asynchronous technology can really be powerful and transformative. And you can absolutely deliver high quality care safely and efficiently without real time interaction. And I think by doing so, there can be significant benefits for the patient, the provider, and even the health system as a whole.
Christina, thank you so much for sharing your time and insight. And thanks again for being on the show.
Thanks for having me, Kevin.